In this STEM we are looking at TOTAPs. This will specifically look at assessment of injuries. This happens while the player is still on the field. Assessment of injuries TOTAPs. If the athlete is conscious, the TOTAPs method of injury assessment can be used. This will provide information about the extent of the injury and whether performance should be continued or medical aid sought. T stands for talk. This is where you would talk to the victim to gather information about the cause, nature, and site of the injury. O stands for observe. In this stage you need visually examine the site of the injury. Look for deformity, swelling and redness. Where possible, compare with corresponding area. If there is deformity, likely there is a fracture or serious ligament/tendon damage, medical assistance is needed. T stands for touch. The first aider is required to feel the site of the injury. Gently touch the site without moving it. If possible, feel the corresponding side and compare. Note differences in shape and temperature. A relates to active movement. This area and the next must be kept separate. Ask the casualty to attempt moving the injured part. Observe degree of pain and range of movement. Compare and feel for clicking at site. If unable to move or can move only minimally, then Ricer procedure is used and medical assistance sought. P relates to passive movement. The first aider moves the injured part and determines how much free movement is possible. If the patient cannot have a normal range of movement without pain, Ricer should be administered. The final stage is skills test. In this aspect, if the player is permitted to return to the field of play, they would need to complete a skills test specific to the sport being played. For example, a soccer player would be required to kick a ball and run stepping left and right.